Immunizing the public against misinformation. The World Health Organization said in a report dated August 25, 2020 that they are actually listening on your online or airwave conversations to mitigate misinformation about COVID-19. Social listening with artificial intelligence. Countering fake news or rumors is actually only responding or mitigating when it's too late, said Nguyen. What we've put in place in the beginning of the pandemic is what we call a social listening approach. Who is working with an analytics company to incorporate social listening into its public health messaging development, a first for the organization. Each week, the company reviews 1.6 million pieces of information on various social media platforms, then uses machine learning to conduct searches based on a newly developed public health taxonomy to categorize information into 4 topics: the cause, the illness, the interventions, and the treatment. This helps who track public health topics that are gaining popularity and develop and tailor health messages in a timely way. Examples include how does a pandemic end, and how do we know when we have a second wave of the virus. Not everyone has access to social media or the internet, but they remain just as prone as anyone else to being exposed to misinformation. To overcome this digital gap, who is working with colleagues from the UN Global Pulse Initiative, which uses artificial intelligence and big data to tackle development and humanitarian issues and to apply social listening to countries where radio is a popular medium of information. In Uganda, for example, more than half of households rely on radio for their news, and thousands of Ugandans call into local programs every day to talk about issues from the most mundane to serious topics such as health care. The Kampala branch of UN Global Pulse uses an automated speech recognition tool powered by artificial intelligence to translate the radio recordings from the local dialect into digital English text. The initiative was featured in the UN Foundation's Innovation in Action series last year, showcasing how the UN is leveraging innovation and fresh thinking to address the world's most pressing challenges. Previously, a vaccine was touted as the solution the world was waiting for, but not anymore. World leaders and the public must learn to manage the virus and make permanent adjustments to their daily lives to bring the virus down to low levels, WHO Director General Tedros Adhanom Ghebreyesus said during a news conference from the agency's Geneva headquarters. At the same time, we cannot go back to the way things were. In particular, the COVID-19 pandemic has given new impetus to the need to accelerate efforts to respond to climate change, he said. The COVID-19 pandemic has given us a glimpse of our world as it could be, cleaner skies and rivers. Can you recall we had already heard similar sentiments somewhere before?